This whole controversy that's going on and the series of reports that have come out about the shortage of Remdesivir drug. Now, Remdesivir is actually one of those very few drugs that have been allowed to be used for treatment of COVID patients, especially in the serious cases. But it's just recently that the government had given permission and then the production started. For the longest time, we only had one company that was producing it, which is Hetero, and they produce about 20,000 vials, which was then specifically sent to cities which had a large number of cases. So, in states of Tamil Nadu and Maharashtra, and specifically then in Hyderabad and Ahmedabad, these are the places that actually, and Delhi, of course, that actually got these vials. Now, what has happened is, even though obviously the stock was very limited and we are quickly running out of it, outside of that, there is also enough and more evidence of it being black marketed, hoarded and black marketed. So it's actually not reaching the hospitals as much as it should. Each doctor has a horrid story to tell about how they themselves have patients, a dozen patients who need it desperately, but the medicine is not available. Each family has a horrid story to tell about how they've gone from one hospital to the other, called up dealers, called up distributors, chemists, run all over the place. Some have even driven from one city to the other simply because they're trying to get this drug. So that is something that the government needs to look into, crack down on these black marketers. That being said, I think I also want to tell all of our viewers that situation should hopefully improve soon, because now one more company, Cipla's drug, is in the market. It's hitting the markets as we speak. They're hoping to produce and ramp up their production to 80,000 vials per month. That, along with Hetero stepping up its production, should help. Then there is a third company, Mylan, will also has the approvals and should hopefully start producing soon. But viewers, there will be a bigger problem, which is the problem of when there is lesser of a drug available and more people who need it, how do you distribute it? And I think our governments are not being able to and are not tracking it enough and closely and handling this situation properly. There is some amount of chaos within the supply chain that needs to be fixed.